Hi, my name's Andrew Williams. I'm one of the consultant plastic surgeons here at the Skin Surgery Clinic in Guiseley. I'm going to be talking to you today about inverted nipples, what causes them and what we can do to help. So an inverted nipple, or otherwise known as a retracted nipple or an invaginated nipple, is a nipple which is in a position whereby it doesn't protrude from the breast. It's quite a common problem with incidences ranging from between 2 and 10%. There are various grades of inverted nipple according to whether or not the nipple is able to be everted by manual stimulation or whether or not the nipple simply will never come out. It's usually caused by the fact that the ducts from the breast tissue to the nipple are too short to allow the nipple to come out. And this can be due to various different causes. It may be that an individual is born with ducts that are too short to allow the nipple to come out, or it may be during breast development that the breast growth occurs at a rate greater than duct lengthening, in which case during puberty or during pregnancy, the nipple will become inverted. It's also important to remember that there can be infections or inflammation or lumps within the breast that may cause an abnormality which causes further nipple inversion. And if an individual has inversion on one side, which is associated with a lump in the breast or nipple discharge, I would encourage you to seek assistance from your GP, who would likely refer you to a breast unit for further investigation. So there are various treatment options for inverted nipples, and these will be tailored to an individual's requirements. It would partially depend upon the grade. It may be that a suction device, such as the nipplet, may be useful to cause nipple eversion. It may be that if a lady wishes to have a piercing, then when the nipple is everted, a piercing can be placed to keep it more prominent. If neither of these options are suitable or the patient doesn't get the result that they're looking for, then surgical intervention can be considered. This is a local anaesthetic procedure which can be performed here at the clinic. It's quite a short operation and involves a small cut in the lower outer part of the nipple. The ducts underneath the nipple are divided, allowing it to be everted. A hammock of sutures is then placed underneath the nipple to keep it in an everted position, and it usually stays in this position. As with all operations, there are risks and potential complications with surgery, and these can be discussed at further length on an individual basis. But the results are usually very good with a very high success rate. Please visit skinsurgeryclinic.co.uk for further information.